So if you're over 40 and you're trying to strengthen your core, most likely you're trying planks, you're trying crunches. But what if I told you those exercises might not be the best for you, especially if you're a woman over 40 who has had kids in the past, or you're experiencing any pelvic floor problems like bladder incontinence or prolapse or even back pain. Your core is responsible for supporting your midsection and your pelvic floor, but some exercises can actually create more issues. And so you want to learn the best ones to do. A weak or improperly trained core can actually cause poor posture, long-term back pain, or even more pressure around your bladder. So in this video today, I'm going to show you the best core exercises and the best routine to do for women over 40, one that is completely safe for your pelvic floor. You'll be able to build more strength, stability, and just more control and confidence in your movements on a daily basis. So if you want a strong core without harming your pelvic health, then keep watching. My name is Dr. Dawn Andalone. I'm a pelvic floor physical therapist and Pilates instructor. So a strong core is essential for balance, for posture, also for back support and bladder control. Not just the way it looks for aesthetics, but more about how your body is functioning and moving through life. So many traditional exercises like planks or crunches are going to put a lot of pressure, intra-abdominal pressure, along the area of your pelvic floor or your abs. This can make problems worse, such as diastasis recti, that separation of the abdominals after childbirth, having more symptoms of prolapse or pressure down on your pelvic floor area, and also other pelvic floor conditions. So this safe and effective workout is going to require no equipment, but it is going to be the best workout for women over 40 when starting to really build that foundation from the inside out with the core. So for these exercises in this video, I'm going to be using a mat on the floor. You can also do this wherever you're comfortable on your back. We're going to do some side lying and exercises on your back. So the first exercise is going to entail some diaphragmatic breathing. This is so important to connect your pelvic floor to your diaphragm and your whole core system, getting it to work together more efficiently, and therefore it can create less stress on your pelvic floor. So you're going to take an inhale through your nose, breathing into your belly, and then an exhale through your mouth. And what we're trying to do is let those shoulders and the neck totally relax so you get the air more down into this lower part of your belly through the pelvic area. So you're going to inhale and exhale here, and imagine that you're just relaxing those muscles around the vaginal opening. You just want to be able to not push against them, but think of them opening, kind of like a flower opening up on your inhale, and then you exhale and you'll feel your belly rise and fall. So that is the first exercise. We're going to do about 10 of those with diaphragmatic breathing. You can also practice this sitting up, but for the purpose of this and getting everything nice and relaxed and aligned, this is a great place to start, is just practicing your breathing. The next exercise is heel slides. So we're going to take that breathing exercise, but now we're going to engage those muscles by pulling them in and up, thinking of the vaginal muscles plus the lower belly. And we're going to slide one leg along the floor as we keep the pelvis, those hip bones, real stable. You don't want to get a lot of rocking and rolling. We're going to pull those muscles in through your core as you slide one leg in and out, and keep those tight, and then let them go. And then we're going to tighten and squeeze again, and we slide one leg out and then bring it back in. So I'm just sliding the leg along the floor and drawing it back in without letting my pelvis rock side to side. These are also some basic Pilates mat exercises. And then make sure you try to let those muscles go every couple reps or so, or when your leg comes in, you can fully relax. So you want to do 10 of those on each side. You can make this more challenging by having your legs up and you're exhaling as that leg goes out, using those pelvic and core muscles, extending one leg at a time. This is a little more advanced version. Use your breath And keep that deep abdominal engagement, pulling in through the pelvic floor and your abdominals as you extend one leg out at a time. So that is a more advanced variation of that exercise. Then next we're gonna do a glute bridge with core activation. So we are going to pull in and up. Imagine a marble pulling in and up from the vaginal opening. So those deep pelvic muscles. And then you're gonna lift your bottom up. And then let it all go and relax on the way down. And then exhale, pull that in and up. Squeeze through the pelvic floor and the core. And then roll back down. So we're gonna go through 10 of those glute bridges, making sure that you're not poking your ribs out. You don't want to flare those ribs out. Keep everything connected through here and think of lifting the glutes as you pull in those pelvic muscles at the same time. That's your glute bridge. Next we have the dead bug exercise. Looks like a dying bug. So we're going to take our arms up toward the ceiling, sink those shoulders back in their socket, and then I'm bringing up my legs so my knees are bent about 90 degrees. My knees are over my hips. I'm going to, it takes a little coordination, I'm going to move the opposite arm and leg away from each other. And while I do that, I'm going to keep my abdominals pulled in and I'm breathing at the same time. If this is too challenging, just try first with the legs or try first with the arms only. Exhale, inhale it in, exhale it out, inhale it in. So you're gonna do about 5 to 10 on each side. If you feel your back is like really coming off the floor, off the mat, stop, reset, get your muscles engaged, and then try it again. That's a dying bug exercise. So you can see that you're really using those deep abdominals in a different way rather than just doing crunches. Okay, next we're gonna turn on all fours. In this position, it's good to change positions when we are working these muscles because in real life, we have to move in different positions and your trunk muscles need to get used to that. So we have our head nice and aligned with our hips, flat like a tabletop. Your lower back stays, your entire spine really stays pretty flat. We're gonna pull those muscles gently in and up, engaging your deep pelvic muscles, and we're gonna extend the opposite arm and leg. Notice how you don't wanna rock your hips. You wanna stay like your hips are facing the floor without a lot of shifting and twisting. Every time you extend, don't arch your back. Keep that core connected. Imagine a seat belt around your waist and you're pulling those muscles in and up. You may even think of a little lift from those vaginal muscles that kind of helps stabilize everything. So that is the bird dog. You're gonna do 5 to 10 of those on each side. And if that bothers your knees, you might want a pillow under your knees or a cushion, something to make that a little easier. So why does this work for women over 40? Well, we're focusing on that deep activation, not just surface level, working your abs, and you're not putting extra pressure down on your pelvic floor. Rather than we're encouraging your breathing and alignment so you can pull in those muscles and have support before you move your arms and legs. Overall, you're reducing a lot of pressure on the pelvic floor and also on the abdominal wall. So safe for diastasis recti, safe for prolapse, and keep the breathing going, making sure that you're not just focusing on your belly muscles and pulling those in, but you want to imagine a little lift from those vaginal muscles and using your breathing as you're doing it. So these exercises can be done daily, just a few minutes for this quick series, and I know that these exercises can be highly beneficial if you're staying consistent over time. I also have a full Pilates workout of pelvic floor related Pilates-based exercises like you're seeing here, but a full class, a full series for 15 minutes straight that changes every day of the week. And I'll put a link to that program below for my pelvic floor Pilates program that will give you even more of a great workout with the same goal of eliminating incontinence, helping back pain, helping tone your midsection, all doing it in a safe way so you're not putting more pressure on your pelvic floor and you're doing things correctly, especially as a woman over 40. So I hope you found this video helpful. Comment below after you start doing these exercises. Let me know how it goes. I want to hear from you. Thanks so much for watching, and we'll see you again in another video.